Welcome to Revive Conversations. This is our webinar series that keeps the conversations going around healthcare, innovation, and patient and member advocacy. My name is John Lufburrow, the CEO here at Revive, and I'm joined by my friend and our head of AI, Pham. Hi, Kathy.
Hi, John. Hey, everyone. Thanks for joining us.
Yeah, thanks for joining. So our topic today is AI in healthcare, and we're going to talk a little bit about some of the things that we're doing. We're going to talk about AI in general in healthcare. But I wanted to kind of start with saying that most people are familiar with how AI can be a tool to achieve greater efficiency in business, in their daily lives. But when it comes to healthcare specifically, share some of your thoughts on how AI is changing experiences.
So, a lot of us experienced this era of AI by using a lot of different chat tools, right? You go into your favorite chatbot, you type in questions, and you get back a series of really interesting answers from things like coordinating your kids' schedules to travel to things like that. What makes healthcare really interesting is we're seeing scenarios where you can do that with healthcare information. So maybe there's information that you just want to learn more about yourself, your health, etc. But the big part that is really valuable is the part where you can orchestrate and navigate healthcare. It's almost like the opposite of being in a chatbot where you want to spend more time in there. It's the how do I get you out of here more
Right.
quickly because it can get you where you need to go. Maybe it's getting you to the right appointment. Maybe it's understanding all complexities of like your entire plan and your whole health and getting you to the right kind of care. Even maybe to even know that physical therapy existed and it can get you there. And that for me is the most exciting part about healthcare. It's the orchestration and the navigation of it, knowing your context and then getting you where you need to be so that we can go back to the human connection part of it.
To me, that's always been a big differentiator for us at Revive is because we're very passionate about getting people connected very quickly
Yeah.
with another human that can help them. And we're seeing how AI, as that orchestration layers you shared, can be a way to actually accelerate or make that kind of beginning part of the journey more efficient. And I love that. And so you were posting recently on LinkedIn, and I'd encourage everyone to follow Revive and follow Kathy on LinkedIn. But there's a really nice team that you're working with that's very smart, very capable. And from your perspective, and you're really the expert here. So what do you think is special about how Revive thinks about that AI first member journey that we've spent so much time talking about?
Yeah. But the best team. And when I think about who is, if we're say like an AI builder, it's pretty much everyone in the company. It's our amazing engineering designers, product managers. Shout out to Dan, Lucas, Pat, RG, Garrett, Steven for building out what we're doing now. And it's our clinicians who are at the forefront of mental health, Dr. Julie Marshall, Dr. Andy Escu, and our Chief Medical Officer, Dr. John Olson in pharmacy, their perspectives on how people are experiencing healthcare, pharmacy, mental health is equally as important as the decisions we're making around which AI model we should be using. And as equally as important as the people managing our infrastructure and technology like Dave Colville, and as equally important as our customer service and customer success managers like Robin and Randy. All those components of how our members and our customers experience the product and our clinicians, and then talking to our members directly as well. We see all of these different individuals as part of building what AI and technology looks like inside a healthcare platform like Revive. And that's what gets me excited. It's everyone comes to the table with their ideas, and then we figure out the sliver of the paths to go forward to build the best member experience to get people the care they need.
I love that. And I like that you mentioned the broader team too, right? Because, we don't build things kind of in a vacuum here. That chief clinical team that you were talking about, they have sign off authority on anything that could touch the members' clinical care quality or even our providers, right? Our clinicians, if there's any change to what they do in the workflow and the way that we deliver care, our chief clinical team is right there at the forefront, making sure that we're always delivering the highest quality of care. And then some of the other broader teams you talked about, right? Because it does take kind of,
Yeah.
I'm
Yeah.
excited, and you and I have talked about this, is there's so much potential here when you think about the member journey and the design of a really nice kind of premium intelligence layer throughout our platform, helping to guide people, navigate them maybe to benefits, answer simple questions, nudge them when they need a nudge or some extra support. There's so much
Yeah.
potential with AI. That's where our focus is, right? And you're seeing all sorts of different companies in healthcare maybe focus differently and putting a lot in kind of automation and workflows and things like that. But we really index on the member kind of experience and how AI can enhance that.
When this era of like the chat tools came on forward in like the 2022-23 era, it's made it so that you have this like corpus of information. It could
Yeah,
be the entirety of what's online on the internet. It could
right.
be the entirety of your health profile. And it's enabled an ability to be able to more quickly go through that and find things you just might not otherwise see. So in your
Yeah.
private life, it might be like a city you would never maybe visit. But in your personal life, it might be like a healthcare intervention that you just never knew would solve like a COPD problem, leukemia issue. It surfaces things. So how do we surface this for our members, orchestrate and help surface areas where you all can get the best kind of care and services you might otherwise just not know about.
Yeah. And how do you tailor it and make it so personalized, right? Those are the things
Yep.
that I know the teams are working hard on because we don't want to build anything that doesn't have tremendous value to our customers, to our members, and we're excited about that.
Yeah.
A little bit more about like kind of human in the loop operating model. So we see Revive's AI as this really great orchestration layer, or some people will say premium intelligence layer that can kind of run throughout the whole stack of benefits. But this part of our mandate, right, is like the human in the loop operating model and making sure that we aren't creating kind of additional steps or barriers to care, right? And so, can you talk a little bit more on why that's so important and why you think the team at Revive is getting that right?
I'm going to flip it a bit to a framing
Okay.
I've used when I was in a research lab years ago called AI in the loop. And I flipped it because we want to be building systems where we figure out where technology fits versus systems that are technology first, where we somehow are like, oh, where does the person fit into this?
Right.
It's like we have these deeply human processes, whether it's getting a person to urgent care the moment they need it, getting a person to the mental health provider, or escalate either one the moment they need it. And we go first with the what is our human process? Like when someone is in their state of need, where do they have to go? And then we layer in the AI component. It's like, oh, maybe this part of chat will help you get to a better schedule, or maybe this part of an AI orchestrator will help you find a kind of care. But we start first with the human, like the deeply person human. It's like human in the loop always.
You're right.
And when you design with that in mind, it's natural to be like, oh, we'll make sure our head clinicians review certain content. We'll make sure that you double check that, like, we'll ask you for prompts about scheduling an appointment. We'll also make sure you double check the schedule before we actually make an action. So there's a lot of steps in the way when you come from the foundation that, of course, this process is human first. And then we fit AI in. So along the way, we're just asking lots of questions and making sure we validate with the person and the right person, whether it's a clinician or a member or an employer along the way.
Yeah, great answer. And I'm glad I asked it in the backwards way so that you could flip it because I think
Well, it's
think the
not.
oh, I think the answer is more
It's the
memorable.
most common. Human in the loop is an actual concept and could be like it's the most common way. But our team just decided to say, you know what, we're just going to make it AI in the loop because we want to design a world where we have to figure out where AI fits
Yeah.
versus where a world where we have to figure out where humans belong.
I think that is appropriate. So it's a great way to explain it, and I appreciate that. Well, and I know we've just got a few minutes here. You've spent the good part of your career working at the forefront of technology, and I know you're really passionate about healthcare and driving innovation. So just give me a little bit about why you're so excited to, not only to what we're doing here, but maybe even broader, how healthcare is going to change and being a part of that is exciting to you.
From everything I've done in building healthcare data systems and going through family members' cancer battles and just being immersed in the space of how do people get care when they need it, it's that orchestration layer of surfacing. You can have all the access in the world, but when you don't really understand how to access it or even understand you have those kinds of tools, it's really hard to get the help you need. And what I love about Revive is at our core, we think about the whole person. So, however, our technology and our business evolves and how we expand, it's how do we think about you as a whole being, from what you need in mental health services, what you might need physically, what might you need long term versus short term urgent care? These are all things that the healthcare field needs today. It's the ability to orchestrate between all of these different disparate components. And then we're also, you combine that with just the state of AI the last few years, being able to ingest a large amount of information and then be able to help us find paths forward, because it can say, oh, I've noticed that over the last 10 years, you've taken these medications, seen these providers, and these are the resources you have available. Like, that's a pretty common use case now. I'm excited to take this core foundation and provide and pair that with the capabilities of what we're seeing with tech today, and continue this whole person, whole health, holistic mission we have for just taking care of people.
I love that. Thank you for joining us, Kathy. I'm excited about where we're going. It is exciting when you have a company with a heart that wants to do it the right way and build from
Yeah.
the ground up something really valuable for customers and for members alike, right? Because
Yeah.
our mission, very simple, right? We deliver integrated whole person care that is always accessible, always affordable, and always awesome. And in order to do that, we've got to have great people such as yourself and many others that are involved in building. So we thank you for that. So everyone, this was our brief and bright Revive conversation. This is part of our webinar series. Please follow us on LinkedIn. Follow Kathy, follow myself. We'd love to continue the conversation on LinkedIn, and we'd love to see you at our next webinar. So again, thanks for joining us.